This presentation tonight will be on the use of B-Strong blood flow restriction training devices, and in particular with reference to those over 50. And we'll tackle a number of the problems that we see in baby boomers and seniors. My name is Jim Strayg-Gunderson. I'm a physician and researcher and one of the founders of B-Strong Training. And the talk tonight is titled Blood Flow Restriction Training, B-Strong Training Systems. And the first slide that we have here is of Mount Fuji in cherry blossom time or spring in Japan. And the reason for this slide is that elastic blood flow resistance training originated in Japan 50 years ago. One of the things to say is that an 18-year-old Yoshiaki Sato was, he had to attend a funeral service in Japan, and he had to sit in this size-up position for many hours. And when he rose, we would have said our legs had fallen asleep, but he felt that the feelings that he had were similar to when he did an exhaustive strength workout in the weight room. And he kind of just put this in the back of his mind, and then he decided to think about how it was he was going to recreate this feeling for his legs in training. The next thing that happened was in 1973, he was skiing at Hakone Ski Resort, which is outside Tokyo. And he ended up having an ankle fracture, a trimalleolar fracture of his ankle, as well as an injury to his knee that's not clear exactly what that was. But in those days, they treated these fractures and knee injuries with full-length leg casts. And for those of you who are therapists on the line, you know full well that anytime you go into a full-length leg cast, there's a tremendous amount of atrophy that happens in the course of a very few number of weeks. And so much so that the routine in those days was to bring the patient back at 6 weeks to change the cast so that it actually held the fracture in place, because there had been so much atrophy that there was all this room in the cast. And Yoshiaki Sato ended up doing something during this time where he ended up taking a judo belt and applying it several times around the top of his thigh above the cast. And he would just crank on that judo belt and do isometric exercises inside the cast. And at 6 weeks, he reported back to the doctors to change the cast. When they took the cast off, they noticed that he had very little atrophy and that both his ankle and his knee were not tender anymore. And they said, well, can you get up and walk around? And he got up and he basically walked right out of the clinic and didn't need another cast for another 6 weeks. And so this was the first indication of something that is a truism that we use, and that is you can heal musculoskeletal injuries in half the time that it normally takes. And we do a lot of, one of the big things that is done is to mitigate the atrophy that normally comes with disuse or not utilizing the extremity or having it put in a cast. So that was really his first hint that he was onto something. And he had a personal training clinic in Tokyo where he did something that he called occlusion training. And they would take various wraps and belts and straps and a variety of things, including some bicycle inner tubes, judo belts, ace wraps, as you can see in one of these pictures, and put them on such that they would then do a strength workout, and they would get a very good pump, and they noticed that they were also getting stronger. And Sato's interest was in bodybuilding, so they ended up taking this to competitions where they would go through a workout pre-competition to get a good pump, and so that they could compete successfully. Now, the European bodybuilders that saw them doing that, they observed them, but they were unable to communicate with the Japanese in terms of what it was they were actually doing. And to tell the truth, Sato and his friends were not really interested in telling the Europeans what their secrets were. So the Europeans, they knew that the Japanese were being successful with this, and so they started reinventing the wheel on their own. And so in the 90s primarily, you see what Sato calls katsu training develop in Japan into using an elastic form of blood flow restriction training, and people in Europe and some in the United States using whatever they could find off the shelf to do what they thought that Sato was doing. And things that were typically used were blood pressure cuffs, some judo belts were again used as just basically they're a rigid strap, and you know they developed all sorts of things about how they put these things around, how many times around they would wrap these devices. However, how this is all settled out is here's a classification of blood flow restriction training devices, which I think is an important point for all of you to recognize. Here we have the first separation is to pneumatic and non-pneumatic devices. Non-pneumatic would be things like judo belts or ace wraps, those sorts of things, where pneumatic devices would be things like blood pressure cuffs or surgical tourniquets or katsu bands or RB strong bands. So the first thing is this pneumatic versus non-pneumatic division, and the kind of so what of that of having that pneumatic aspect is that you can control and reproducibly control the amount of pressure and everything else that you're putting on the extremity. And in that way, you have a greater chance of being safe and a greater chance of being effective. Then the next division, if we focus on the pneumatic controllable devices, is whether it's elastic or rigid. Blood pressure cuffs are rigid. They have an inflatable inner surface, but once the blood pressure cuff is attached, the cross-sectional area inside the blood pressure cuff cannot expand beyond where it's wrapped. And that's the same thing with surgical tourniquets. And so we classify those as rigid pneumatic devices, where Katsu and now Be Strong are elastic in that they're both capable of expanding or stretching when force is applied to them. And this ends up being a very important safety feature, where if you have a rigid system, it's not going to accommodate the increase in muscle cross-sectional area when the muscle contracts. The muscle becomes ischemic. Nerves that are contained in that area become ischemic and injured, and can become injured. And also, it's easy to occlude the extremity when the muscles are contracting so much so that they're shutting down and increasing the pressure on the arterial inflow. Where elastic devices end up stretching with the muscle contraction and therefore leave arterial inflow intact. They don't produce ischemia in the muscles, We'll see in a little bit that they also avoid an exercise pressure response, and there's a little chance of nerve injury. And so this is kind of where we are now. If we look at the differences between B-Strong and KAATSU, essentially the KAATSU device has a single inner tube like a bicycle tube, and where we have a series of multiple barrels that are independently inflated. And what that does is it provides an extra measure of safety, where the KAATSU bands can be inflated to where they might occlude the arterial circulation, but ours are limited so that they cannot really do that. So up to the capacity of the pump, our bands cannot occlude the arterial inflow. And that has important safety features that we'll get into in a little while. But in addition to that, in comparison with KAATSU, we're much more affordable. We're about 1/10 the price. We've tried to make these things so that anybody like me can use them, and so they're idiot-proof. We have made these things in a way that it's easy for someone to use them themselves, where the KAATSU devices end up typically requiring an expert to do that. And ours are comfortable, and they can be used anywhere, anytime, with any activity by anyone. And so with that, I think we'll go to the next slide. And what this does is this demonstrates what happens with a rigid cuff on the left-hand side, a blood pressure cuff, and a elastic B-Strong band on the right-hand side. And what we have here is we have a Doppler ultrasound that's looking at the brachial artery and venous flow. And then we have these hand pressure pumps in the foreground. So what we'll do is we'll start the video. And what you see now, this is with the rigid blood pressure cuff, and it's wide. And here you have, it's not inflated, and here you see the brachial artery pumping away. And then what's going to happen is we're going to increase the pressure in this band up to 150 millimeters of mercury, which will be above the systolic blood pressure of this individual.
Go up to 150 on the...
And here you see we're at 150 on this with no arterial inflow. And then we're going to
release the pressure.
We're going to let it go, and you're going to see the arterial inflow being restored right here, along with some venous outflow. So on the other hand, here's the B-Strong band, and what you see with this is here's the arterial inflow pumping away, and now we've already pumped this up past 150, and there's still vigorous arterial flow. And now we'll go to 300, and with continued flow, and then on to 500, the maximum of the pump, and we still have that flow and the arterial flow in the background. And so this ends up showing that we, have occluded the arterial inflow at a very low pressure with the rigid system, and we can't do that with our up to 500 millimeters of mercury with our elastic system. This slide shows really the past 20 years and how many references on blood flow restriction technology or the topic have come out. And as you can see, in the first decade of the 21st century, there's a handful of articles a year, most of them being KAATSU articles. And then from about 2010 until today, just a steady increase in the number of articles that are that have been produced and published in scientific journals. And today, we're getting to where there's a pretty good documented evidence for a lot of different things, from safety to efficacy to um, mechanisms and that sort of thing. Something here. One of the things to say is that Be Strong training systems is used by a wide variety of people, all the way from adolescents to um, 95 years young, and for all sorts of applications. One of the big ones is most of us adults in this middle area that are trying to juggle kids and work and sports and all sorts of things at the same time. And this can be used by, well, we say from 9 years old to 95 years old. And here we have a picture of a young lady with her leg bands on, going for a walk on her driveway. And we have used these things with very young kids down to the age of 5 with different musculoskeletal injuries. There's no problem in that respect. And there's no problem on the other end, where even in nursing homes with very debilitated people, we can put Be Strong bands on them and do some form of exercise that allows them to make progress with their ADLs. Here's some other examples of uses. This is a young college student just doing a regular workout. Here we have a stroke patient in Japan having walk training going on with her Katsu belts on. We also have some top athletes with, here they're using all 4 bands at the same time and pulling a weight sled. This young man has PTSD from Afghanistan and Iraq, and he finds that this Be Strong exercise program is very helpful for him to deal with his issues. Here we have an aging bodybuilder over 50 using these things and getting a great workout. And this is an example of a Japanese speed skater who did nothing but Katsu and speed skating, and ended up winning a number of Olympic gold medals and setting world records in the 500 meters and the 1,000 meters speed skating. Here's something now more back to home. This is a 53-year-old male who had his left hip replaced in March of 2014, and it took him essentially 10 weeks to get back to his normal activities. Then on December in 2016, he had his right hip replaced, and he used Be Strong bands right from the get-go. Here he is on first post-op. There's nothing wrong with his arms, and he's doing a workout at his bedside. And here you see his right hip's all bandaged up. Post-op day 2, they ambulate these young men, and here he is again using the Be Strong bands on his upper extremity while he's doing some walking. And here at 3 weeks post-op, he's got pretty good quads on both sides. And then at 30 days post-op, this is a little video that's not quite working right, but basically his leg bands on and a weight vest, and he goes running up and down the stairs. And so he was returned to his normal activities in 5 weeks, where it took 10 weeks for his other hip, where he did not do Be Strong. So healing in half the time. Here's another case of a 25-year-old soccer player with a grade 3 MCL tear, posterior horn tear of the medial meniscus, partial PCL tear, and a lateral bone bruise. He was put in a lock brace at 30 degrees for his MCL, and no weight bearing for 2 weeks. However, we did rice twice a day, and we did Be Strong BFR exercises twice a day with no pain at the injury sites. Now, that's a very important thing for all the therapists out there, is anything goes as long as you don't stir up inflammation or pain in the site of the injury. So, for example, we had both of his arms to use, and we had his um, left leg to be able to use. And we also used Ultra G ambulation at a very light weight starting from day 3. So, you know, he was on crutches with no weight bearing, but he was able to get in the Ultra G at a very reduced weight and ambulate from very early on. And here he is at day 20 with nearly full range of motion and virtually symmetrical quadriceps. And he still had a little mild tenderness over the MCL, but there's no swelling. And his physicians released him from care at 5.5 weeks. Careful soccer practice at 6 weeks, and he was playing a game at 8 weeks. And this is at least twice as fast as these kinds of injuries end up taking to heal. There's another application. Now, this is with seniors, and this is both for osteo and rheumatoid arthritis. And one of the problems that these arthritic patients have is it just hurts to do any exercise. But here we can get the exercise low enough and so that it doesn't hurt them. And here, this young lady, she's got her armbands on and she's doing some pulls on an elastic thing. You can see the arthritis in her hands a little bit. And over here, this young lady has rheumatoid arthritis. She came into us in this wheelchair. And we got her so that she was able to walk afterwards. And you also see the little arthritic changes in her hand. And what's great about this is this really is the difference between not being able to do any kind of activities to being able to do something. And gradually with these programs, we increase their strength. And once we start increasing the muscle mass, then there's less stress on their joints for doing ADLs. And before you know it, they're back functioning near normally. Another exciting development with Strong BFR in seniors. This young couple was in the habit of getting DEXA scans every 2 to 3 years to look at bone mass. The young lady was osteopenic, and here we see that when she was normal when she was 63 years old in 2011. Then in 2014 or 2015, she was labeled as osteopenic. She had lost 9% of her bone mineral density from the last scan. And then in January of 2016, she and her husband both started a Be Strong training program and changed nothing else. They didn't change their diet. They didn't use any different medicines. And they maintained their other forms of exercise, which included cross-country skiing, some cycling, those sorts of things. And then when they had the repeat scan in October of 2016, so 11 months from the previous scan, and with 8 months of Be Strong training in that area, now all of a sudden her bone mineral density has gone up by 5.2%. And this is actually a remarkable finding. And most of the medications they give to arrest osteopenia just basically hold bone mass the same. Here we have stumbled across something that will actually improve their bone mass. And it wasn't just her. Her husband had very similar results. Actually, he improved his bone mass 6.9% in that year, where he had just steadily had negative results previously. So another application of Be Strong is post-op rotator cuff repairs. These things can be notoriously hard to rehab, and you have to be very careful with the repairs. But here we're using weights that are light enough. And this young man over here, he's got his Be Strong band, and he's swinging a golf club. He liked to play golf, but the club's not very hard, and we're just doing mild exercises with that. Over here, he's got a couple of, I think these are 6-pound weights, doing various exercises. And again, the idea is that you, very early on, within 2 or 3 days post rotator cuff repair, you can start rehabbing the shoulder girdle. Another application is post-PRP or stem cell injections in the shoulders. And one of the things that's nice about that is, again, we're using very light weights which don't further aggravate the joints and help the stem cells and the PRP to adapt to what new stresses they have, like essentially very light exercise as opposed to doing nothing. These, and one of the things with both those last two shoulder slides, the bands are below or distal to where the shoulders are. And so how is this blood flow restriction technique working on tissues that don't have their blood flow restricted? And here we have some more examples of that, where this young lady was in an auto accident and had several thoracic vertebral fractures. And here she has all 4 bands on her extremities, and they're all very distal to where her fractures are. And she healed up or she ended up with no pain in her thoracic spine in a matter of a few weeks. And this gentleman over on the right-hand side had a median sternotomy for a cardiac procedure. And we started using the Be Strong bands to get that median sternotomy to heal, but we also improved his range of motion in his neck, where he had some ankylosing spondylitis. And here is one of our stars. This is a guy who was a C4-5 quadriplegic, literally in a bed on a ventilator for a year, and then gradually was able to be weaned off the ventilator. And around between 1.5 years and 2 years, he started to get some movement and some sensation in both his fingers and his toes. And we ended up taking this to where he's doing all sorts of kind of exercise, or the kind of exercise he can tolerate. And he came into us in a wheelchair, and he now walks with a cane. And this is unheard of. In retrospect, his quadriplegia was the cord was just partially damaged, or I should say contused, and that healed to an extent enough where he has essentially sensation and motor activity in a lot of the motor units and fibers. But it's still not normal. But being able to walk with a cane as opposed to being in a bed on a ventilator is a huge thing for him and his self-esteem. And then just to kind of finish up on these applications, here we have riding a bicycle with leg bands on. Here we have some roller skiing on a treadmill with all 4 bands on. And we can do things like go outdoors and do a lot of tight turns on some very easy slopes, and not risk injuring ourselves, because if you fall on these blue groomers, it's not a big deal. And but you're able to get the same kind of stressors that the racers encounter on the ice-injected slopes of the race courses. And these bands go everywhere, where this young lady is using them in the Pacific Ocean. And One of the things to say is that you don't want these bands to inhibit any of the normal technique that's going on, but they can go anywhere with pretty much any activity. So, like with any kind of procedure that we use in medicine, there's indications and contraindications for this. And our indications are pretty much anyone, anywhere, anytime with any activity. Although we rarely do BFR sessions on children younger than 5. And there's no real reason for that. It's just whatever musculoskeletal injuries they have, they'll heal pretty quick on their own, and we don't want to bother the child with a bunch of bands. The only absolute contraindication is for those people that can't exercise at all. So an example of that is someone with homozygous sickle cell disease, and they end up having sickling crisis when they exercise or go to altitude. That kind of exercise would also not be advisable from using the Be Strong standpoint. But essentially, anybody who has permission from their doctor to do any kind of exercise can avail themselves of our elastic BFR training or Be Strong. There are some relative contraindications. Some of these are very common sense, but don't start your Be Strong session during a medical emergency. If you're having a heart attack, go to the ER and have that taken care of. Same sort of thing if someone has a flu. Don't come to the center with your flu bugs and get everybody else infected. And also, you're probably not doing yourself any good training when you have a fever. This question comes up a lot, is we don't advise to start a BFR training session when you are pregnant, but plenty of women are pregnant and they are doing Be Strong, and then they realize that they're 3 months pregnant or 2 months pregnant, and they've been doing Be Strong right along. And so for those people that got pregnant while they've been doing, not exactly while they've been doing Be Strong, but if they've been doing that kind of program, then it's fine as long as their doctors feel it's okay for them to exercise. It's the same kind of advice that they would get for any kind of exercise program. Don't do Be Strong training while you're operating a vehicle, because the fatigue that can come from doing these things properly can end up getting in the way of you controlling the vehicle. Don't place a band directly across a fresh wound. A good example of this are total hip operations, where there's a lateral incision on the upper thigh where the band might go across. But use the other 3 extremities instead, like you saw with our total hip patient, where there's nothing wrong with his arms or his other legs, so have at it with the Be Strong bands. And this also emphasizes this idea that we're looking for a systemic effect. We're not putting a band on a leg so that we can get that quad stronger. We're putting bands on all the muscles so that all the muscles can get an anabolic stimulus. The same thing goes for a limb with lymphedema, where we run into that in this country is if someone has had radiation to the axilla for typically breast cancer, and sometimes that has disrupted the lymphatics in the axilla. Just go ahead and use the other 3 extremities. Same thing for vascular access or indwelling catheters, such as those on hemodialysis. Just use the other 3 extremities. And by the way, with these number 6, number 7, it's the same sort of thing. The physicians don't want you to put blood pressure cuffs on those extremities. They want you to use the other one. So anywhere where you're not supposed to use the blood pressure cuff, you shouldn't be using a Be Strong band. Then one of the central things is whether it's a sprained ankle or ACL tear or a shoulder or whatever, don't do exercises that cause pain in the healing injury. It's fine, and we're looking for fatigue and discomfort in the working muscle, but not in the injured part. Is blood flow resistance training safe? And really the only data that is in the literature looks at using KATSU, or elastic blood flow resistant training. In 2005, they did a study, and they had a response, or 12,642 people turned in their questionnaires. Those people had gone under approximately 32,000 KATSU sessions. They found 6 cases of DVTs in those 12,642 people, and they all occurred in this, essentially this 22% of the patients that were in hospital or hospitalized at the time. And what's interesting about that, that's actually a lower incidence of DVTs than would be expected in a normal hospitalized population in Japan, where about 1 in 100 of the hospitalized population have DVTs. In this, it was 1 in 2,000, which is much better. 1 in 100,000 in the general population. There was 1 pulmonary embolism, and there was 1 case of rhabdomyolysis in these, among these sessions. And so the take-home message here is that when used as directed, elastic blood flow resistance training can be very safe. The way that one gets DVTs is you need all 3 components of what's called Verko's triad. You need stasis of blood flow. And one of the things, since B Strong cannot occlude the arterial inflow, we do not get stasis of blood flow. And the next thing that is required is endothelial injury, which you have anytime you do surgery on someone where you're cutting across blood vessels. That produces an injury. And then you have this hypercoagulability risk factor. And there's not much to do about that. But with B Strong training, you don't have endothelial injury and you don't have stasis of blood flow. So you don't get DVTs. One thing that we're often asked about is what about blood pressure? And the first thing to say is that blood pressure goes up from rest to exercise normally, and that those people with hypertension can sometimes have an exaggerated response. Often people over 40 or 50, the type that we're talking about, they may or may not have high blood pressure. If they know about it, hopefully it's treated and it's not abnormal. But occasionally it's possible to find somebody with uncontrolled blood pressure that doesn't know about it. Fortunately, with B Strong BFR, that's not an issue, where it is a very significant issue with the rigid pneumatic devices. And to address this issue, there was a study that was done at the University of Austin last year and presented at the American College of Sports Medicine meeting this past June, where they used a wide rigid system called a Hoxton cuff. And they had, this is just control walking, no cuffs. And here we have a set of B Strong bands on. And the treadmill, they did 10 minutes of walking at 2 miles an hour with a series of 2-minute bouts with 1 minute of rest and deflation between each bout. And here you have their blood pressure responses, and here you see the change in systolic blood pressure, where the bottom curve, or the least change, basically increasing from rest to exercise at 10 millimeters of mercury, is the narrow elastic bands, the B Strong bands, where the normal, no bands at all, just normal walking, had a 15 millimeter of mercury increase in their blood pressure. And these 2 curves are significantly different. And then with the wide rigid cuffs, there is a very exaggerated blood pressure response, up to 40 millimeters above the resting levels for systolic blood pressure. Similar sorts of things with diastolic blood pressure, although there were no differences between the narrow bands and the control walking, while there was a robust increase in diastolic blood pressure with the wide rigid cuffs. And mean arterial pressure shows essentially the same things. And this can end up being a risk factor for those with cardiovascular disease. And here you see myocardial oxygen demand being much greater with the wide rigid cuffs than it is with either the control walking or the neuroelastic walking. And again, you see that the neuroelastic B strong bands ended up being significantly less myocardial oxygen demand than the just normal walking. While you saw just a very different, very small difference in heart rate between the three things. So one of the things to say about that is that for any patient that hypertension is an issue, if you use elastic pneumatic blood pressure B strong cuffs or bands, then you're going to be safe. This is one of the better studies looking at efficacy in the literature, and it's Journal of Applied Physiology in the year 2000. The first author is Takarada. And I might bring you over to panel D, where we have, in all these panels, we have elbow flexion torque, or the ability to flex your bicep on the y-axis, and the speed at which that's happening on the x-axis. And this is just testing twice with about 4 weeks in between, showing if you're not doing any training, this test is pretty reproducible and no real difference. Then if I take you up to panel A, these people did 4 weeks of a typical high intensity, 80% of 1 rep max arm training with bicep curls. And here they are showing nice increases in strength at all speeds of motion with the typical standard heavy lifting regime. And then over here on panel C, now instead of 80% of 1 rep max, they're using 30% of 1 rep max. And here they're showing just a little bit of an increase, but it's showing that 80 versus 30, you really have to kind of get after it to get the kind of increases in strength and hypertrophy that you're looking for. On the other hand, if what you do is you put on elastic BFR belts, here you have the same degree of improvement, but in this case they use the same they use the same 30% of 1 rep max, but they put elastic blood flow restriction training belts on. And so what we really see here is that you can do 30% of 1 rep max with bands on and get the same response that you can get with standard heavy lifting techniques. And this is really the seminal study that shows that this stuff works in terms of strength and hypertrophy. Some other exciting news is that here we have evidence of angiogenic stimulation from BFR. That basically means building new blood vessels and capillaries and that sort of thing. And what we have on the y-axis is mRNA expression. When some protein gets upregulated or stimulated to change, mRNA ends up coming out into the blood and can be measured. And here we have basically light control lifting in the black bars, and in blood flow restriction weight training sessions in the open bars or the white bars. And you can see that for most of these hormones and enzymes that there's a dramatically different mRNA expression when you're using the BFR. And this is for VEGF receptor 2, HIF1 alpha, various of the nitric oxide synthase systems, enzyme systems. And what this means is that these are all the components that are necessary to build new and better blood vessels or to repair endothelium. So in addition to building stronger and bigger muscles, you can build more and better blood vessels. And then this slide is a reminder really to show what the process of a nerve contraction to a muscle, and that is where you have synaptic vessels in the nerve cells with acetylcholine in them, and then you have receptors on the muscle surface that are looking for that acetylcholine receptor, and this induces a current that ends up in the final analysis causing an increase in muscle contraction. And the point of this is, as we age, we lose all these acetylcholine receptors here, and we lose the number of synaptic vesicles. It's represented by this, where there's less of these receptors and less acetylcholine, and therefore there's less of a transmission, or less of a coordinated transmission of contraction in the nerves. And to investigate this, now we're going to turn from humans to rats. These rats they had a form of blood flow restriction where they tied off the femoral artery in a rat. And when you tie off the femoral artery in a rat, the leg doesn't die, but at rest it's fine. There's enough collateral circulation, but they don't run very well. And what you see here is, in the upper bar is a soleus, or a slow twitch muscle, and in the lower bar is a fast twitch muscle, the extensor digitorum longus. And it's really, the fine print here is hard to read, but these bars where there's a significant increase this is the BFR plus exercise, where these other things are just BFR alone, or exercise alone, or control, or that sort of thing. But what this is showing is that in this rat model, by tying off the femoral arteries, you can get the kind of muscle hypertrophy in both slow and fast twitch muscle that you expect to see in humans. The real meat of their study was they also looked at the nicotinic acetylcholine receptors. And here again, you had an increase in these nicotinic acetylcholine receptors in the BFR plus exercise group. And so what is really happening here is they're taking a situation like this in an older rat, and by doing BFR and exercise, they're getting it to look more like the younger rat and reverse some of the kinds of things that happen with aging. And it's not just nerves, and peripheral blood vessels. Here this is another rat study that was done looking at the effect of blood flow restriction along with low intensity exercise on T cardiac structure and functions in the aging rat, and the role of angiogenesis. So the bottom line here, and what they show, is that they're upregulating the combination of blood flow restriction and exercise is increasing, in this case, mRNA, again for VEGF, and in this case for FIT1 GAPDH. And what this is saying is that the rat heart muscle is improving, looking more like young rat heart. And so when taken together, our findings clearly demonstrate that this kind of exercise can improve age-related attenuation of angiogenesis in the heart. So for anyone over 50, the use of elastic blood flow restriction training can improve muscle and muscle function, improve peripheral blood vessels, improve cardiac blood vessels, and improve neuromotor transmission as well. So, and then in addition to that, increase bone density, which is also good. Another study, one of the things that we were talking about in this thing was sarcopenia. Another study in Austin, Texas has been started where their question is, do 12 B-strong sessions and creatinine supplementation reduce the incidence of morbidity and mortality in post-hoc sarcopenic abdominal cancer patients? One of the things that happens with people that have abdominal cancers is they lose a lot of weight and a lot of muscle mass, and it's been shown that their morbidity and mortality post-operatively is related to how much muscle mass they've lost. So these physicians are trying to reverse that and see if by building muscle and lean body mass that they can improve the morbidity and mortality of these operations. And so they have taken those with an abdominal GI cancer, and a diagnosis of sarcopenic. Ultimately, they'll be looking at 100 patients. The program was 12 30-minute Be Strong workouts over a 6-week period in a clinic setting. The patients came into the clinic twice a week. And they had a loading dose of creatinine supplement in week 1 and then a maintenance dose for the other 5 weeks. And they also tested body composition with weight, skin folds, and girth, as well as strength testing and grip strength. And so far, the last time I checked, they had about 10 patients through the whole protocol so far. It's too few really to evaluate for morbidity and mortality, but they all gained lean body mass and they were all stronger on their hand grip thing. So that is looking at like it's an important tool. A little bit about how this works. The two things that happen is here we have some near infrared spectroscopy showing a bicep curls just normal with no band on. And here we have the same bicep curls with a band on at higher and higher pressures. And we're measuring the amount of oxygen in the muscle really with this. And what you see here with normal exercise is it goes from the mid 60s down to the mid 30s and goes along, and that's kind of a normal response. But when you do it with bands in place, the amount of oxygen in the muscle goes down really into the basement, and if it's long enough and hard enough, it ends up being failure of the exercise. And what happens is essentially the blood flow restriction is enough to slow down the delivery of oxygen enough so that the tissues cannot sustain the low level of work that they were doing. The normal situation is that you use light weights to recruit type 1 fiber and moderate weights for sub type 1 and type 2, and then you need really maximal weights to recruit all sorts of fiber types. The way we do it with Be Strong is that as the oxygen is depleted in these type 1 fibers and they fail, then the type 2 and the type 2X end up needing to take over the work, even though the weights stay very light. One of the things is, so now we have the bands in place, and when you first inflate them, what they do is they cause proximal venous obstruction and vascular distension in the tissues. And then when you start to exercise, then the muscle itself pumps the blood in these distended veins and capillaries back towards the heart past the venous obstruction of the band. The artery is left alone during all this time. So at rest, the circulation is severely restricted, but the muscle contraction itself ends up being a muscle pump and pumping blood into the tissues, but it's still not enough for the tissues to maintain or sustain those contractions. And then again here, this is also interesting in that both muscle that is distal and proximal to the BFR belts ends up getting the benefit. So the triceps, they're usually below the belt, and their blood flow is impeded or restricted. But the pecs are just fine. And what you see here is that you get a hypertrophy of both the pecs and the triceps when you're doing bench press exercise with elastic BFR bands in place. And that adaptation happens very quickly. This is a matter of days. This is really 2 weeks to get significant hypertrophy in both the triceps and the pecs. And why would all that be? And here we have our bicep with its elastic band in place, doing bicep curls, and running out of oxygen as it's doing this. And there are nerve fibers that are sending information into the brain that are saying, hey, my environment here is deteriorating. try to do something about it. One of the things it does is it causes an increase in sympathetic tone, and that sympathetic tone increases heart rate and cardiac output and contractility and a little bit of blood pressure in an effort to get more blood flow to that muscle and reverse that oxygen. But in addition to that, there are synapses that go into what's called the thalamus and then the hypothalamus, which end up causing the pituitary gland to release growth hormones and endorphins and a variety of other things that then flow throughout the body. And any muscles that have been exercising are now going to get the benefit of both the local effects of exercise and the systemic effect of these hormones that are circulating throughout the body. And that's shown on this slide, and where we see, compared to control exercise alone, there's a very robust increase in lactate with a elastic BFR session. And then in addition here, this is growth hormone over here, where there's a very fine grained line going along the bottom here, where there's really no change in growth hormone from a workout that's 30% of 1 rep max, where the same workout of 30% of 1 rep max with elastic BFR bands in place shows a very brisk growth hormone response. You see growth hormone, one of the things it does is it breaks down fat. And so one of the findings we often see is that people become much leaner. And in addition, it goes to the liver and stimulates production of insulin growth factor 1, which is also an anabolic hormone. And we also see we saw the improvement or the increase in VEGF, or vascular endothelial growth factor, over time with these things compared to control exercise, again demonstrating that local thing. Okay, we have a number of questions here. One from Herb. It's for a 70-year-old with a diagnosis of growth hormone deficiency due to an injury who takes HGH. Would BFR allow her to potentially decrease her HGH by making the circulating of growth hormone better utilized? Well, it depends on how badly her pituitary was injured. If it's not going to be making any growth hormone, then the BFR won't or can't stimulate the increase there. And so it's, what I would say is that she may be able to have higher doses of growth hormone if she starts doing a BFR thing, but should have to work with her doctor for that. Another question with a 21-year-old male with a growth hormone deficiency. I think the same answer. I don't think that BFR will get a damaged pituitary to produce growth hormone where it doesn't otherwise. But for this kind of thing, and if the guy's doing any kind of normal sports, he could use a higher level of growth hormone. With Ehlers-Danlos syndrome, I don't think it would affect it necessarily positively or negatively. The Ehlers-Danlos syndrome is a connective tissue problem, and the growth hormone that's put out would not really influence this. Bill ends up asking, I have a patient with it's a high-level competitive gymnast with proximal hamstring tendinosis post-PRP. At what point is it okay to put the bands over the proximal hamstring? And I would say within 48 hours, 72 hours of when that injection was. And I think gentle exercise will be good in all aspects for these PRP questions. Next question from Josh. Has there been any studies related to jumping, college level volleyball player. I don't know of any studies per se, but we've had a number of volleyball teams take up using B Strong bands, and in a matter of weeks, they've improved their vertical jump. But this was not done in any kind of systemic study way. This is literally done with a club volleyball team around here. But they were very happy with the effects on their ability to jump. How different are B Strong cuffs from the rock cuffs? They're very different. The rock cuffs end up being an example of a rigid, non-pneumatic cuff. They have a gel insert, and that gel is non-compressible, so you end up having the same problem that the rigid blood pressure cuffs have compared to B Strong elastic pneumatic cuffs, where the inner aspect of the inflatable cuff is compressible. Jim asks to remind people that need to scroll down. Leanne, safe for mild lymphedema in lower extremities, otherwise heavy middle-aged woman. She may very well have swelling in her ankles and her lower extremities, but I don't, unless she has a specific injury to the lymphatics in the groin. It could be an example of elephantiasis is one disease that does this, but there the lymphedema is very dramatic. The same thing with the radiation injury that does it. Swelling in the legs and lymphedema or interstitial edema is not necessarily related to lymphedema in these cases. And what I would say is that B Strong would be very helpful for this young lady. What precautions should we take with geriatric populations with chronic medical histories? Yeah, it depends what you mean, but if we're talking diabetes, if we're talking heart disease, previous stroke, any kind of previous cancers, arthritis, all of those populations will be helped with the idea of being able to do any exercise at all. There's all sorts of cardiac rehab programs or rehabilitation programs for these kind of patients. And with some of those patients, it's just impossible for them to do any kind of useful exercise. And so B Strong comes in here really in a nice spot where just, things like lifting a glass or getting out of a chair can be used as exercises with the bands on, and people show progress towards their activities of daily living.